Hi, my name is Gianna Gelb, and today joining me on the show is Francesca Gelb, a critical care nurse who's worked for COVID-19 patients. So Francesca, tell me more about what it's been like pre- and post-pandemic.
Well, pre-pandemic, we, as nurses in the ICU, did not have an idea of how to manage and really maintain infection control appropriately initially. We had PAPRs initially, but that there weren't enough resources for that, so personal protective equipment and how we go into the rooms in the ICU setting became a really big part of keeping us safe and our families safe. And for example, in the past, pre-pandemic, we would have patients who had different, multi-drug resistant organisms. We'd wear a gown and gloves, but with COVID, we'll wear gowns, double gloves, N95s or like a 3M mask, usually a hair covering, goggles. It's a lot more protective gear to make sure we don't spread the virus.
Mm-hmm. And in terms of treatments, how did you take care of your patients over the last 18 months?
In the beginning of the pandemic, we, as clinicians, physicians, nurses, had a grab bag of treatments that we were using. Some of those were not necessarily clinically sound. For example, we were using a drug called Plaquenil, which also known as hydroxychloroquine, which wasn't as effective, and it was causing many patients to have dysrhythmias, things of that nature. But as time went on, through research and clinical trials, we developed sort of an arsenal or a toolkit, if you will, of medications that were really effective. For example, antiviral drugs such as remdesivir has proven very successful. Different adjunct therapies like steroids to help reduce the inflammation in the lungs. Medications such as dexamethasone, it's called, has also been very successful.
And with regard to treatment, how did your patient population become affected through vaccinations?
Through the introduction of vaccines into the general public, we're finding that the patients who have an increased risk of mortality are those that are unvaccinated. A lot of research has gone into the vaccines, and the cases in which we're experiencing in most ICUs around the country now, and no exception to locally, those that are dying are those that are unvaccinated. They have a significantly higher risk of mortality.
Yeah, and how was it like being the first in the country to be vaccinated?
I felt happy, I felt honored. Many of us were excited to get a vaccine and to help bring an end to the pandemic. I was a little nervous because, it's a new thing, but I mostly felt relieved that I had an extra layer of protection for my family, because moreover, I was worried about getting the virus and bringing it home to my family than even for my own health at times. So.
Yeah, and according to the CDC, a year ago today was the all-time peak for COVID. How do you feel about that?
I believe that's true, that about a year ago is about as bad as it was in many ICUs. I've told many people, and for me, professionally, it was like akin to war. Like, people were dying left and right. I mean, we were running out of supplies. Morale was very, very, very low. But we were able to, persevere through all that, and eventually the numbers did wane.
Mm-hmm. And can you describe what the hospital was like during that time?
During that time, on the unit, more common than not, visitors were not allowed on the unit. So when patients were passing, we would get iPads, we would bring them up to the mirror, up to the window of the rooms, and the only way we could let families know that their loved one was dying was by holding an iPad and showing them, we're so sorry this has happened, and it was very sad.
I mean, nurses were quitting left and right, and the hospital was being overwhelmed with patients. How did you deal with that?
Well, we had a lot of support from administration, and I think the best way we got through it was just leaning on each other. Nursing, I think, especially in an ICU, is like a very team-oriented sport, and one of us would help another if their patient was critically crashing, or if they weren't doing well, or if they needed to be intubated, things like that. It really, how we got through was leaning on each other.
Mm-hmm. And was there anything positive that came out of COVID?
I hope that a positive thing from COVID would be we now know how to manage and deal with infection a little bit better. Many infectious disease specialists will cite that there's another COVID right around the corner. There's another virus right around the corner that could wreak havoc on a global scale. So hopefully what we've learned is to quarantine ourselves if we're ill, to wear masks, to distance each other so that the droplet infection can't be spread from human to human to human.
Yeah. And how did you protect yourself during this time?
Well, the personal protective equipment that we'd use, or the PPE, this is my go-to guy that I've been using for like 18 months. It kind of goes on and off. It's a great tool for protecting your eyes, protecting your face, but the problem is no one can hear you with this, so I always find I'm just yelling just so people can audibly hear what I'm trying to communicate. Kind of like a similar guy is this little guy that we use as well. The challenge with this is that you'd still have to like cover your eyes so to avoid droplet contamination that way. So we'd wear a little face mask with it too. There's the old tried and true N95 if any of you guys have ever seen those. It's kind of stifling to wear, but as a rule, most of us will wear this on the unit for like 12, 13 hours in conjunction with like regular surgical masks and the face shield. Again, we try to cover our hair because if we're suctioning orally intubated patients, we don't want any of the aerosolized particles of the virus to kind of like get in our hair or anything, so we'll cover our heads. As a rule, wear shoe covers. I usually double glove if I'm doing something invasive with COVID patients, and then we have gowns that we wear into the room too. These are disposable, in which we kind of dispose of them once we are done with whatever task we're doing for usually the mechanically ventilated patients.
Well, thank you for joining me today. I had a great time learning about what it was like as a perspective as a nurse. Well, I'm Gianna Gelb, and this is People in Perspective.